this kind of irresponsible prescribing without retesting. And then we're also in the age of hormone pellet factory mills that have crazy ass high hormonal levels, and it's stuck in your body for like 6 months.
Samantha had stage 4 endometriosis.
Ah.
She had 3 laparoscop. How do you say that word?
Laparoscopic surgeries.
Yes. PCOS, high testosterone and estrogen, bled uncontrollably before my hysterectomy.
So I want to show you guys that what none of your doctors are willing to ask and are educated in are what are the underlying hormone patterns that produce these symptoms and disease and imbalance. What are they? So there's estrogen dominance. There's something I call low everything. Some people may have low estrogen. Some people may have low testosterone. Many people may have actually PCOS or hidden PCOS. Okay. And there's many shades of these patterns. I just want you guys to know. And I am willing to bet you right now, none of the doctors, I would say 99% of doctors that you have begged to test your hormones, that you've gone to see for these problems, understand what you are seeing on the screen right now. This is like, to me, basic. This is Hormone 101 for functional medicine doctors, but your regular doctor, your gynecologist have never seen this. They don't even understand what it is. Every gynecologist I've ever met, except one, doesn't believe estrogen dominance is a real thing. And I'm going to be like, bullshit. Okay. I'm a fan of the cursey word. So if you don't like that, I'm sorry. But it's just bull. And now here's the problem. Most of the time, a hysterectomy is because of uterine bleeding, too much bleeding. Okay. The underlying cause of someone needing a fibroid removal is too much estrogen feeding that tissue. It's a area of the uterus that's very sensitive to estrogen. So it's because of what? Estrogen dominance. Okay. Why does someone need an endometrial ablation? So imagine your uterus is like a horseshoe. Okay. That's your uterus. Okay. And inside the uterus is what we call endometrial tissue. So they're almost like little seaweed coming out. And the uterus itself is very sensitive to estrogen. And the lining inside is very sensitive to estrogen. So what happens is if somebody makes a lot of estrogen, or they have problem breaking down estrogen, okay, then they're going to develop a condition where there's more estrogen compared to progesterone. And that's a condition we call estrogen dominance. So guess what? All of you guys that have these surgeries, and many of the symptoms we're talking about here is related to one of the many different types of hormone imbalance, but one of the most common reasons why people need surgery is because of estrogen dominance. Now, instead of dealing with the underlying cause of estrogen dominance, what do? We wait till someone has a fibroid the size of a football. We wait till someone's bleeding to death like a stuck pig. And then we say, let's just remove the organ. What happens? What happens? Just like you don't deal with digestion and you just remove the gallbladder. What happens if you just remove an organ like your uterus or remove the fibroid and have the endometrial ablation? What happens to the underlying hormone imbalance in the first place? More hormone problems. They stay estrogen dominant. This is really common. I've seen so many women have hysterectomy, and their ovaries might be intact or might not be intact. But let's say they left the ovaries in and it's the partial hysterectomy, right? Then what happens is the estrogen dominance is caused by the ovaries that are making those hormones, right? That didn't go away. The uterus went away, which is one of the targets of that problem, one of the end targets of that problem, just like the gallbladder went away. But the underlying problem is sitting right there in plain sight that nobody has dealt with, which is what? Estrogen dominance. And the problem is that the doctors don't know how to test hormones. They don't know there's even a pattern called estrogen dominance. And they don't know what to do with it. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. I'm going to show you someone who's had a hysterectomy, who got on hormones, and then developed 3 autoimmune diseases before they came to see me. Okay. And here's what the results look like. And I have data. I'm not making this up. Okay. I'm not feeling this person's hormonal woo-woo. This is a very common scenario of someone, anybody, but this happens to be a post-hysterectomy female who didn't have her ovaries removed and was taking a whole bunch of hormones. But this might as well be, I would say 80% of women and men that are on hormones, you might as well show these results to them. Just because you get a hormone prescription, even if it's a natural bioidentical hormone, doesn't mean you have hormone balance. And here's a perfect example. Look at this person's hormones. Do you see this? Do you see these numbers right here? I'm just going to give you perspective here. I mean, and I will tell you right now, your doctors don't know what to do with these hormone levels. You bring the symptom, they'll be like, this wasn't needed. You're fine. This person was told that their hormone levels were fine. Look at where the estrogen level here on this graph, top red line is red alert, too much. Okay. And to give you perspective on this number, okay, look at the chart on the right. 0.8 to 12 would be what we would expect for someone taking hormone replacement. And this person is 285.1. This would be the amount of hormones in a fertile cow who's 1,000 pounds. But look, they're bioidentical hormones. They're being prescribed by a hormone specialist. Really? Are they a hormone balance specialist? Are they educating this client who got 3 autoimmune diseases as a result of this hysterectomy and these hormones being prescribed? Look at the progesterone here. We're looking at the top range here, should be 3,000, 8,497. I mean, and this is a woman's result, okay? I want to just give you some clarity around this. And I see every week. Look at the testosterone level here, okay? And let me see if she's taking testosterone here. Yeah, she's taking 3 milligrams of topical testosterone. That's a ridiculous dose, by the way. And the high range of this is 55 for a woman. 872, okay? Men make testosterone levels 10 times of women. So the highest range a woman should be is 55. This woman is at 872, which is high normal for a male who's about 20 years old. Guess what her symptoms were? Weight gain, irritability, insomnia, lupus, Sjogren's, myasthenia. Okay. And we're loading this much hormones in her. And did anyone talk to her about digestion? No. Did anyone talk to her about blood sugar? No. She has fatty liver. Did anyone even measure her hormone levels after she was prescribed? No. And did anyone ask her if she has a bowel movement every day? No. She poops once a week. How do you think her fermentation and recycling is going? This is the typical case that I see of people who are taking hormones. So then is hormone, like, you're like, oh, then is hormone replacement the answer? It could be if someone really does need it, but at this kind of dosing, this kind of irresponsible prescribing without retesting, right? And then we're also in the age of hormone pellet factory mills of hormone experts who give hormone pellets that have crazy ass high hormonal levels, and it's stuck in your body for like 6 months. And that's typical. Nobody wants to be in the business or in a mission or a movement to educate providers or patients to understand this, because you know why? It takes time and doesn't make them a lot of money. But lining up 10 people to get hormone pellets every hour for 8 hours a day does. So there's a big problem here with how people are, even functional or naturopathic providers are prescribing hormones. And it is in no way about hormone balancing, and it's in no way about you being educated. They're not educated themselves, and it's not about you being educated, being the driver of this, understanding what these results are and what can be done. This person's hormones were straightened out in about 3 months with complete remission on all 3 of these autoimmune diseases over that 3-month time frame. How? Because we walked through the circle and we understood what all this meant, right? So what was the biggest takeaway here? I would like you to jump in. Is this ringing light bulbs for anybody, right?
Oh my gosh, Dr. Maggie, people are saying, wow, you know, they're showing emojis of like the, I've never heard this before. And tying it all back together, you know, we had one comment from Celan saying, you know, my sister-in-law had a hysterectomy. Do you think that's why she now needs her gallbladder removed? It's like
Yeah.
we were talking about.
So she had a digestion problem in the first place.
Right.
But then also is connected with her hormone problems, her estrogen dominance, inability to ferment and break down, right? Those hormones. So it's really actually common for someone to have multiple surgeries relating with some similar causes that are in the root cause in the first place. To learn more about how to balance your hormones and to work with us with my hormone masterclass, click the link above or below this video.